This is an important video. I'm going to cover things today that I have not heard covered before, and let's start with where we are, okay? So in the modern world, obesity is rising, non-communicable diseases are rising, and you sort of question how can this exist alongside the flourishing fitness and health industry, where it appears that with a few simple lifestyle changes you can be in perfect shape with a button-down shirt, smoking a cigar on a rooftop bar in Dubai, leaving behind your out-of-shape self with your chest bursting out of your shirt. And I feel quite strongly that misinformation is like a windmill that's creating this turbine and airstream of absurd sales, promising a better life, but in reality it never delivers. This is going to be broken down into 3 sections. So the first one is something I have somewhat experienced, the formal education, the qualified health consultations, all that sort of thing. Next up is going to be the fitness side of that. So people coming from, fitness, gym, trying to give health advice. And the last bit is just going to be what I think actually works, because I think the first two have so many problems with them. So first up with the role of formal education and what I like to call the qualification Olympics. And by qualification Olympics, I mean that by people leading with their qualifications and pretending like they're right just because they're more qualified. Like, yes, a doctor with qualifications and is up to date on research and can keep things applicable is a great person to talk to. But at the same time, there are so many people with degrees at the moment that have no idea what they're talking about, but they still think they're right because they have a degree. Having finished my master's now, I have sat through so many lectures where the lecturer just does not know what they're talking about. Literally, some of these things go directly contrary to what the scientific literature says, but it's like, oh, you're a doctor, you must know, right? If you've seen that video of Dr. Paul Saladino going on that show, The Doctors, ever since I've seen that, I've felt a little bit sour about this. And if you haven't seen that, I really recommend that. That really shows what I mean about the qualification Olympics, because I like Paul. He's got some interesting ideas, and what they did on that show, it's exactly what the problem is. One of the main problems I have with qualified nutritionists is they fail to keep things applicable, particularly for people that are dealing with sports people, athletes, people in the gym. It's like, how are you gonna give them the perfect advice if you don't have any skin in the game yourself? I had one assignment in university that required us to make sort of a calorie surplus diet, and my lecturer didn't like what I handed in, but it's like, okay, have you ever tried to maintain a high level of training while eating like upwards of 4,500 calories a day? One of us has, and it's not you. And so how are you going to tell me my ideas don't work? It's like they have worked for me and multiple people who I have helped. It's like they didn't realize you can't just scale up your diet to reach that calorie total. You know how much food that is of like regular stuff? You got to add like quite a bit of oil and things like that to make it hit the mark without, feeling sick. And I'm sorry if I'm coming across a little bit bitter in this section, but I'm just really passionate about this, and it pains me to see people forking out like $200 for a consultation where they just come out with saying, oh, eat 2 extra servings of vegetables. It's just weak advice. So my takeaway here is just to remain skeptical of these people. And that includes me, right? As I said, I have finished my master's now, but that doesn't mean you should blindly believe everything I say, right? Think for yourself, take in all the information that's at hand and make your own opinion. Next up, let's talk about the people in the fitness community. People coming from gym and fitness and trying to move into the nutrition space. Now, I've got my problems here too, but I will say these people usually do applicability and understanding better because they're in the gym themselves or training for something else, and people who are training are, easily going to be able to help other people that are training because they understand it, right? And although some of the ideas have scientific basing, it seems as though the big trendy ideas really steal the show and divert things from what actually works. And one of the biggest ones I see is overemphasis on calories and macronutrients. It seems as though the rest of the diet can be whatever as long as it's like low calorie and fits some arbitrary like carb and fat split, which in reality, unless they're too low, it doesn't really matter. Like, try and hit your protein target, sure, but I find it weird that we set these strange goals around fats and carbs. And as well, how are you going to make progress if you're in a constant deficit? It seems like everyone is overly obsessed with trying to lose weight, which is a bit strange. It's like if you're training a lot and you're eating, reasonably well, we all know how to eat reasonably well, you're gonna feel good, you're gonna train well, and if anything else, like what are we doing this for, right? My main problem here is some of these diet plans completely miss the mark with micronutrient targets and even quality of life as well. Adhering to a diet like that for an extended period of time is probably just going to leave you a bit unhappy, and it seems as though this never actually stirs up any controversy for whatever reason. Instead, people focus their attention on silly things like natty or nots, but I don't really understand that. It seems as though a lot of these people are sort of fear-mongering, and a lot of people are actually kind of scared of food. It's like they think if they touch a burger, they're gonna completely blow out their diet and look obese in a few minutes. And I wonder how much of this is just trying to stir up confusion and misinformation, and people claiming, okay, if you just buy my supplement, things will be okay. But in reality, people know how to eat reasonably well, and if you do that and you train somewhat regularly, you're gonna feel great, and it doesn't need to be so complicated. Overall, this section's a bit of a mess, and I don't know if anyone learns too much coming from here. That being said, there are still people in this space that really know what they're talking about. I talked to a personal trainer recently who really understood things a lot better than what he gave himself credit for. So yes, there's still people in this space that know this stuff. One of my least favorite things is when people make complaints and outline a lot of flaws, but they never actually put forth a solution that works. So in this last section, I'll cover what I think the best route is to actually understanding eating better. And this is what I think most people would call the evidence-based nutrition. So people taking from the scientific literature, the facts we know, and making it as applicable as possible, and not being too caught up in things like macronutrients. So if you're just spraying someone with facts without much application, I don't think that's very helpful. It's like, dude, you're getting spit in my face, slow down. And application without any scientific basing is kind of just bro science. So if we take an example like, oh, I can't lose weight, maybe a useless certified nutritionist might say, oh, well, vegetables has fiber, and fiber can be linked to weight loss, so eat more vegetables. It's like, oh, thanks. Where'd you come up with that, dude? And then a bro science guy might be like, oh, just eat chicken breast and do fasted cardio. It's like, I don't know. And of course, these are the extremes, but I'm just outlining my point. I think when you can put together the best advice, that comes from understanding the person's routine, their mindset, what their goals are, taking them in as a whole person, and then applying what might be the best changes to make. Ideally, you can put in changes to someone's life that don't feel like massive changes. You can't just expect someone to completely uproot their lifestyle and their diet. Not most people end up on a diet they're happy with eating, so if you're trying to completely turn it around, they're probably just not going to listen to you. I think the best way to get around that is just minor substitutions, like maybe you just sub out a habit for another, or in your meals you sub out an ingredient or two for another. This way you're kind of still doing the same stuff, but it's just better. This way things are so applicable. It's just seamless substitutions, and it's all science-based. And I really don't understand why nutritionists can't do both. Like, you went to university for how many years and you can't figure this out yet? Like, you have one job, dude. I really enjoy the Modern Wisdom podcast, and Chris had a guest on called Menno Henselmans. He's a person that studies nutrition, and he explained things really well in a way that is effective and easy to follow. And the nice thing is it's just so applicable, which is like, why can't more people do this? It's not that hard. So hopefully this wasn't too much of a rant, but I think this was worth talking about. So I'll see you next time.